Thank you, Mayor Platt, very much. I'm not as tall as Mayor Platt, so thank you very much for your gracious welcome and introduction and for hosting us here today. I appreciate it. I appreciate being with the surrogate, who always does good work and helps families in difficult times, and she does it with such dignity and grace and honor. We appreciate her service. We appreciate the councilwoman being with us as well. And thank you for letting me come to your center here to talk a little bit about something that we are happy to announce today, as this month begins an opportunity that we think is incredibly important for seniors. Before that, I just want to say I was talking to the mayor outside as we were walking in. I just came from Ocean City, where we were talking a beautiful day on the shore. I was dressed the wrong way for Ocean City, but we were there about offshore drilling and stopping offshore drilling so we don't end up ever having what happened in the Gulf of Mexico happening along the New Jersey shoreline. We want to make sure that the mayor and I were talking before, and I was asking how things are going, and in his own inimitable way, he said, well, you know, we have a few challenges, but we're meeting them. And he does it really in such a great way. Cherry Hill is such a great community, and he continues to lead it in a direction that enhances the very nature of what Cherry Hill has come to be known for. Great services, making sure that we both take care of those in the dawn of life, our children, those in the shadows of life who face some challenge, those in the twilight of life, our seniors and our families. And so I appreciate the mayor's service, and particularly in difficult times. Always great to be here with you, Mayor, from Cherry Hill. I came today because this is an important month to note that the healthcare reforms we put into place will begin to close something we call the donut hole. Now, the donut hole is a gap in coverage under the Medicare Part D prescription drug coverage for some seniors that unfortunately have a large number of prescriptions. And their costs, there is a gap. There is coverage, and then it goes up to a certain amount. I'll describe that in a moment. And then there is no more coverage, and you fall, that's why they call it the donut hole, right? Because there is a hole that you fall into. And then after you spend X number of dollars out of your pocket, you get out of that, and then there's coverage again. That's the way the law was originally devised. And it really didn't take into account that particularly for seniors who had these higher costs, that it was at the most critical moment when they had less resources to fill their prescription drug coverage, that they were in fact most needy, and yet that's when the gap in coverage created. So when we passed the new healthcare law, one of the things that we decided to do is to close that gap over a period of time so that there would be no more gap for prescription drug coverage. And I know personally how important this is because my mother, who passed away this October, who faced a tough challenge with Alzheimer's and a long illness, I know what we spent in prescription drug coverage for her. And when she hit the gap, she had the good fortune of my sister and I being able to help. But at the end of the day, there are many seniors who don't have that ability. And so we are committed to closing the gap, and it begins this year, starting in June, this June. 227,000 New Jersey seniors who reach the reimbursement limit for prescription drugs and fall into the Medicare Part D gap in coverage, what we call the donut hole this year, will realize the benefits of healthcare reform. Recipients of Medicare Part D who have fallen into the donut hole will receive a rebate check for $250 by the end of the year. The first rebate checks will be mailed 6 days from now on June the 10th, a full 5 days ahead of schedule. 66% of all Medicare Part D recipients, that's the prescription drug program that we're talking about, 66% of all Medicare Part D recipients in New Jersey will reach the reimbursement limit of $2,830 for prescription drugs this year. At that point, they enter into the donut hole, and they're forced to pay the full cost of their medication until they spend a total of $4,550 of their own money on prescriptions. During that period, under the law before, they will not receive any additional reimbursements. Many who reach that gap in coverage will have to dip into their savings to pay the added costs. Some will have to choose between life-saving, life-enhancing medications and putting food on the table or paying their bills. But the Affordable Care Act that Congress passed and the President signed into law begins to solve that problem on June the 10th, and it will close the gap completely over the next several years. It will provide also a 50% discount beginning next year for brand name drugs for those in the coverage gap. So that if in fact one is taking some diabetic pills or heart pills or whatever, and it's a prescription drug that is a brand name starting next year, if that costs $100, well, 50%, it'll have a 50% deduction to it. For those brand names, for those who are in the coverage gap, eventually closing the donut hole completely so seniors can enjoy their retirement, not spending it, fretting about whether they have to skip the grocery store or the pharmacy each month. Along the way, I've come to know, and you don't have to do anything. If you fall in the gap, you don't have to proactively do anything to get this $250. The government monitors that under Medicare Part D, so it will proactively send you the $250 check once you hit that gap. And so therefore you shouldn't be getting anybody on the phone. I know AARP, and we have a representative of AARP who's been very good on this, who is a big advocate for this part of the law to make sure that the gap was closed, and who has been working with many of us in Congress to educate people about what the law brings. You do not have to do anything if you fall in the gap. If that's the particular challenge you have, it will come to you automatically. That means no one should be calling you on the phone, asking you for any of your information, because there is no need to file or do anything to get that check. So anyone who's calling you and saying, I want to help you get that $250 under your Medicare Part D, just to take the phone and hang up on them, because that's a scam artist, okay? They're trying to find information on you that they shouldn't have. You know, along the way, I've met many seniors. I know my mom was always my personal inspiration, as well as someone who I lived the challenge with. But I recently met Millie K. Brown from East Windsor, New Jersey. She's 78 years old. She's going to turn 79 this month, thank God. She typically nears the prescription coverage gap in October. She lives on a tight fixed income. She pays her monthly expenses, and after she does, she only has $200 in disposable income. She takes 4 prescription blood pressure, arthritis, and allergy medications. Her allergy prescription alone costs her $118. It isn't hard to do the math. Having $200 after you pay for all of your prescriptions doesn't give you a lot to deal with in terms of your other needs in life. Helping seniors like Millie Brown is one of the principal goals I had in the Affordable Care Act. As I said last year during our tele-town hall meeting with AARP, the benefits included in the legislation will begin now with the rebate checks being mailed on June the 10th, but they don't end there. Beginning next year, seniors like Millie will get free preventative care services, including cancer screening, mammograms, in addition to a free annual wellness visit. She'll have a chance to get more affordable generic drugs through the creation of a clear navigable pathway for the approval of new generic biologic drugs that will reduce the cost of cutting-edge drugs that are simply too expensive for seniors to afford. And as I said, she could also get that 50% discount on the brand name drugs she takes next year. Finally, we'll close the donut hole, which I opposed from the beginning when this program was created, and we'll do that over the course of the next several years. So those first rebate checks for those who fall in this gap will start on June the 10th and move there forward. As people fall in the gap, Medicare follows your charges, and when they see that you fall in the gap, they'll send you that $250 check. It is the beginning of closing the hole so that seniors never have to choose between putting food on the table, paying their bills, and having access to life-saving, life-enhancing drugs. That's why we're here today.